Every year, millions of seniors walk out of their doctor's office with a clean bill of health. Their blood work came back fine, their doctor smiled, said everything looks normal, and they went home relieved, believing they had been thoroughly evaluated. But here is what most of those seniors never find out. The standard blood panel ordered at a routine physical in America regularly misses some of the markers most strongly associated with the health emergencies that devastate people over 60. Not because those tests do not exist, they do. Not because they are experimental or unavailable. Most cost between $15 and $40. The problem is that a standard blood panel was designed to detect diseases that are already fully developed, not the silent biological changes building toward a crisis years before symptoms appear. The American Diabetes Association estimates that roughly 96 million Americans currently have prediabetes. Most of them have no idea. Not because they never went to the doctor, but because the right test was never ordered. And one of the most important long-term cognitive risk markers identified in aging research is still almost never included in a routine annual panel. Today I'm going to walk you through 5 blood tests every adult over 60 should understand, the numbers that matter, and the exact questions to bring to your next appointment. I'm Dr. Matthew Carter, and after years of reviewing lab work in adults over 60, I can tell you something with complete certainty. Some of the most serious health problems I see are not missed because patients avoid doctors. They are missed because the right tests were never ordered early enough. Subscribe if you haven't already, because by the end of this video, you will know exactly which 5 blood tests can identify risk years before symptoms appear. The first test is hemoglobin A1C. Most people have had a fasting glucose test at some point. That test measures your blood sugar at one specific moment in time, usually first thing in the morning after an overnight fast. The problem is that blood sugar changes constantly throughout the day. A single normal reading can completely miss a pattern of chronically elevated glucose that has been damaging the body for years. The A1C works differently. It measures your average blood sugar over approximately 3 months by analyzing how much glucose has attached itself to your red blood cells. Think of it this way. A fasting glucose test is one photograph. An A1C is a 3-month surveillance recording. And clinically speaking, the A1C is often far more useful in older adults. Prediabetes, defined as an A1C between 5.7 and 6.4%, quietly accelerates damage throughout the body long before a formal diabetes diagnosis exists. Elevated glucose damages the small blood vessels feeding the kidneys. It damages the retina behind the eyes. It damages nerves. And emerging research suggests it may accelerate cognitive decline as well. A 2021 study from researchers at the University of California, San Francisco, found that older adults with prediabetes experience significantly faster cognitive decline than adults with normal glucose regulation. You want your A1C below 5.7%. If it falls between 5.7 and 6.4, that deserves a serious discussion with your physician about diet, activity, sleep, weight management, and metabolic risk reduction before full diabetes develops. And if your doctor only orders a fasting glucose test, ask specifically for hemoglobin A1C by name. They are not the same test. The second test is 25-hydroxy vitamin D. Vitamin D is commonly referred to as a vitamin, but physiologically it behaves much more like a hormone. It regulates immune function, bone metabolism, muscle strength, inflammation, and neurological signaling throughout the body. According to the National Institutes of Health, vitamin D deficiency becomes dramatically more common after age 65 because aging skin becomes less efficient at producing vitamin D from sunlight, while many older adults also spend less time outdoors. The result is a deficiency that often develops slowly and silently over years. Research published in the New England Journal of Medicine has associated low vitamin D levels in older adults with increased fracture risk, higher cardiovascular risk, muscle weakness, and higher rates of cognitive decline. Now here's where many people get confused. Most laboratories list anything above 20 nanograms per milliliter as technically normal, but many endocrinologists and preventive medicine specialists prefer levels between 40 and 60 for older adults. That gap matters. A patient can technically fall inside the laboratory reference range and still have levels that are clinically suboptimal for long-term bone, immune, and neurological health. I saw this repeatedly in practice. One patient, Eleanor, came in at age 68 with persistent fatigue, joint discomfort, muscle weakness, and worsening mental fog that had slowly progressed over nearly 2 years. Her routine blood work had repeatedly been called normal. When we specifically ordered a 25-hydroxy vitamin D level, it came back at 12, which is severely deficient. Within several months of supervised supplementation, her fatigue improved substantially and her cognitive symptoms stabilized noticeably. This is not uncommon in older adults. Vitamin D deficiency is one of the most overlooked and most correctable problems I see. The third test is hs-CRP, high-sensitivity C-reactive protein. This is a direct measure of systemic inflammation inside the body, and if there is one biological process consistently linked to heart disease, vascular disease, cognitive decline, and many chronic illnesses associated with aging, it is chronic inflammation. Inflammation is not always dramatic. Often it is low-grade, silent, and persistent for years before symptoms appear. hs-CRP helps detect that process early. A landmark study from Harvard Medical School following more than 27,000 women found that hs-CRP was actually a stronger predictor of future cardiovascular events than LDL cholesterol alone. Yet despite that, it is still rarely included in routine blood work unless patients specifically request it. What makes this marker clinically important is that it predicts far more than cardiovascular disease. Research from Johns Hopkins found that older adults with chronically elevated inflammatory markers were significantly more likely to develop mild cognitive impairment over time. The inflammation-damaging blood vessels in the heart is often the same inflammatory process affecting blood flow and tissue health inside the brain. You generally want your hs-CRP below 1.0 milligrams per liter. Between 1 and 3 suggests moderate cardiovascular risk. Above 3 warrants a much deeper evaluation into inflammation, metabolic health, weight, smoking, sleep quality, insulin resistance, and other contributing factors. And make sure you ask for the high-sensitivity version specifically. Standard CRP is designed to detect major inflammatory illness. hs-CRP detects the subtle chronic elevations associated with cardiovascular and cognitive risk. The fourth test is TSH, thyroid-stimulating hormone. The American Thyroid Association estimates that thyroid dysfunction affects a substantial percentage of adults over 60, and many cases remain undiagnosed for years. The thyroid regulates metabolism, energy production, body temperature, heart rhythm, bowel function, mood, and cognitive performance. When thyroid function slows down, the entire body slows down with it. The problem is that symptoms of hypothyroidism often look exactly like what people dismiss as normal aging: fatigue, weight gain, brain fog, depression, constipation, cold sensitivity, low motivation. So patients assume they are getting older, and many physicians never look deeper because the symptoms appear nonspecific. Now here's where the discussion becomes more nuanced. Most laboratories consider a TSH level up to approximately 4.5 to be within the normal reference range, but some preventive and geriatric specialists believe certain patients function better with TSH levels closer to the lower half of that range. A result can fall inside the laboratory reference range and still be clinically suboptimal for that individual patient. That does not mean everyone with a TSH above 2.5 requires treatment. It means symptoms, function, and the overall clinical picture matter. If you have repeatedly been told your thyroid looks normal, but you still struggle with fatigue, mental sluggishness, weight gain, or cold intolerance, this is a conversation worth revisiting carefully with your physician. The fifth test is homocysteine, and in my opinion, this is one of the most underutilized blood markers in preventive medicine for adults over 60. Homocysteine is an amino acid that rises when the body lacks adequate B vitamins, especially B6, folate, and B12. When homocysteine becomes elevated, it appears to damage blood vessels and may contribute to neurological decline as well. One of the most important findings from the Framingham heart study was that older adults with elevated homocysteine levels had a substantially higher risk of developing Alzheimer's disease years later. More recent international research has continued to identify elevated homocysteine as a modifiable risk factor associated with cognitive decline in aging populations. And the word modifiable matters, because unlike genetics or age, homocysteine can often be improved. The VitaCog trial from Oxford University found that targeted B vitamin therapy in older adults with mild cognitive impairment significantly slowed the rate of brain atrophy, particularly in patients who began the study with higher homocysteine levels. Those findings deserve far more public attention than they receive. You generally want homocysteine below 10 micromoles per liter. Between 10 and 15 is moderately elevated. Above 15 deserves prompt evaluation and treatment. I remember one patient, Frank, age 76, whose family became concerned about progressive memory lapses and increasing difficulty finding words during conversation. His routine labs looked completely unremarkable, but his homocysteine level came back at 19.2. That result changed the entire direction of his evaluation and treatment plan. Here is exactly what I recommend before your next appointment. Write these 5 tests down: hemoglobin A1C, 25-hydroxy vitamin D, hs-CRP, TSH, homocysteine. Bring that list with you and ask whether they should be included in your next blood draw based on your age, medical history, and risk profile. If insurance coverage becomes an issue, many of these tests can still be ordered directly through laboratories like Quest or LabCorp at relatively affordable prices. If your vitamin D level is low, discuss supplementation with your physician before starting anything on your own, especially if you take kidney medications, blood thinners, or thyroid medication. If your homocysteine is elevated, ask specifically about methylfolate and methylcobalamin forms of B vitamins, which many older adults absorb more effectively than standard synthetic forms. And most importantly, remember this: the most dangerous health problems after 60 rarely begin with pain. They begin silently, invisibly, years before a diagnosis ever appears. These 5 blood tests give you an opportunity to identify some of those risks while there is still time to change the outcome. Comment below with one of 3 responses. Comment getting tested if you plan to ask your doctor about these labs. Comment your age and which of these tests you have already had. Or comment sharing this if you know someone over 60 who needs to hear this information. I review the comments on every video because they help shape what we cover next. I'm Dr. Matthew Carter. Subscribe now, and I'll see you in the next video.